Hi, I'm calling report on a 31-year-old male with a past medical history of type 1 diabetes, gastroparesis, GERD, and depression. He presented to the clinic today for acute symptoms of gastroenteritis, reporting those symptoms for the last 2 days with a history of vomiting and decreased oral intake. He reports that he hasn't been taking his insulin over the past 2 days due to not being able to keep any food down. He is currently wearing a continuous glucose monitor and reports that his blood sugars over the last 2 days with the illness have been in the high 200s. He didn't want to dose any insulin due to fear of low blood sugar since he can't keep any oral intake down. He reports that he has had poor control of his blood sugars in the past and states that his last A1C last month was 8.3. He typically takes 32 units of Lantus every morning. He has not taken that in the last 2 days. Novolog 8 units with meals, as well as a sliding scale on top of that. 2 units for blood sugars of 150 to 199, and then increasing by 2 units per every 50 of blood sugar increase. He currently takes sertraline 100 milligrams once daily, pantoprazole 40 milligrams once a day, erythromycin 250 milligrams once daily, promethazine 25 milligrams every 6 hours as needed for nausea, which he has used in the past 2 days several times. Hyoscamine 0.125 milligrams sublingually for abdominal cramping every 4 hours as needed. He presents today diaphoretic with lethargy and mild obtundation. On physical exam, he did have some abdominal tenderness, decreased skin turgor, dry oral mucous membranes, and he was tachycardic at a pulse of 114. He is slightly hypotensive, which is not consistent with his normal blood pressures in the office. Today he was 101/60. He is presenting with Kusimol respirations with a respiratory rate of 22. His blood glucose in the clinic was 337, and his urine was positive for ketones. The patient dosed himself 8 units of Novolog in the clinic per his sliding scale. The obvious signs of dehydration today and the fact that he's likely in diabetic ketoacidosis are the reason for my referral to the emergency department. He denies any chest pain or difficulty breathing. His lungs are clear bilaterally and heart sounds without abnormality. 911 was called and he's being transferred by ambulance to your emergency department for evaluation and treatment, and they're here loading him now. Let me know if you have any questions. Thank you.